Hello, assalamu alaikum. My name is Dr. Danya Bushwereb. I'm a family doctor from UK, and today I'm going to present headache. The reason I chose it because it's very common, and if you don't come across my channel, the reason I opened it just to explain about common conditions a family doctor sees every day. So let's go straight to types of headache. So as you can see here in the picture, there's a migraine, which usually comes on one side of the head, and then you have the cluster headache, which presents usually with pain behind the eyes. This is really horrible. This one, if it can be like really intense. And then you have tension headache, which is more pain on both sides of the head, and it's more around the forehead. And then a sinus headache, which is more around the face, and it's secondary. Could be like sinus infection or even sinus allergy. Of course, there's other causes of headache, like it could be maybe secondary to high blood pressure. It could be also like even other less common but more serious causes, such as if the headache was secondary to a brain tumor, or even a bleed in the brain, like if there was like a hemorrhagic stroke, or if there's an infection in the brain, like if there's like meningitis. But as I said, those are less common and more serious. And I'll explain about like what are the symptoms in case something like serious happen later. It will be difficult covering everything today, to be honest. So we're gonna focus more on migraine, and then then the other types of headaches. Inshallah, I will explain about them in future like videos. So how does migraine usually present? It's a headache. Its duration is usually more than 4 hours. Can take up to like 3 days, 72 hours. It's usually on one side of the head. In English, it's called unilateral. That means one side of the head. That's more commonly. But migraine also can come on both sides of the head. Can be also bilateral. It can be associated with vomiting, feeling nauseous, and also like there might be like your eyes might be sensitive to light. Migraine can come with something called aura. And sometimes migraine doesn't come with an aura. So what is an aura? An aura is a feeling. Somebody has a feeling and specific symptoms, and that's where they know they're going to have a migraine attack. So what do they usually feel? They can feel nauseous. They can, as I said, it could be like they feel like they're going to vomit, or maybe sensitive. The eyes are sensitive to lights. Loud noises can increase also the headache. Another thing also, like the vision can get a bit funny. Like they might have some visual disturbance, like seeing zigzags, or maybe flashing of lights, or even blind spots. So as I mentioned, like the migraine can present with aura, but there's other migraines which doesn't come with aura. So why does aura happen? Migraine aura, it's due to a chemical or an electrical wave that moves across the brain, and I'm going to explain in a future slide about, in a simple way, about the pathophysiology of a migraine. Why does it happen? So what are the causes of migraine? Well, it could be genetically. We all know that migraine runs in families. If, for example, like maybe like if your father, if your uncle had it, you're at high risk of having a migraine. Stress and depriving of sleep can also cause migraine. And this is quite interesting, because studies shown that if somebody is deprived from sleep during the week, but then over the weekend, if they sleep too much, they oversleep over the weekend, that can actually increase the risk of having like a migraine attack. They're more prone to get migraine attacks from disturbance, like if your sleep is not, the pattern, it's not the same during the days, the normal days, and during the weekend. Food and drinks can also like increase the risk of having like migraine attack, like coffee, alcohol, cheese, chocolate, tomato, strawberries, smoking, processed food. So what are the complications? Migraine, of course, it will affect social life and work. One of the most common causes of going off sick is because of migraine. Imagine if somebody has a migraine attack, they can't go out of bed, they like light hurt their eyes, loud sounds increase the headache. It's not a nice feeling at all, and yeah, it can affect even social life if they have like a party or a wedding, or even socializing, and loud sounds or anything else can like increase the headache. So that can be like really frustrating. On the long term, if the migraine doesn't get treated, it can lead to depression, anxiety. So any headache any headache more than 4 to 5 times a month, your doctor was that's very suspicious that it could be, most likely it is a migraine. So that's where your doctor start to wonder if it is a migraine, and they start to like look into treatment and how to diagnose it more, which I'm gonna tell you in a moment about the migraine diary. One of the other complications of migraine, again, like scientifically studies shown that people with migraine are at high risk of having high blood pressure in the future, and this is very rare. Sometimes, which is extremely rare, a migraine can be associated with a seizure. I never saw it before. I saw many patients with migraine. I never saw migraine with seizure, to be honest, but it can happen. So this is a very simple way. This slide, this picture shows like pathophysiology of migraine. So why does it happen? It's usually because some areas in the brain, the blood vessels in some areas of the brain, they get dilated, and you have, of course, you have like different nerves in your brain and in your head. But there's one of the nerves that's called like trigeminal nerve, and it's usually nerve number 5. That one gets activated, so that's why you get the migraine attack. Okay, so the question is, how can we differentiate it from tension headache, or even maybe other types of headache? So the most famous one is the tension headache. That's the most common headache, right? So how can you know if your migraine is not tension headache? First of all, tension headache, it's more aggravated with stress and anxiety. Okay, a tension headache always come with stress, although even migraine can come with stress. Interesting. Tension headache is usually bilateral. That means it's on both sides of the head, and it's usually in the forehead here. Whereas migraine, although it can come like on both sides of the head, but it's more commonly on one side of the head. There's no vomiting, no aura, you don't feel nauseous, your eyes are not sensitive to light, there's no loud sounds, does not hurt your head. So all of that which goes with migraine, it doesn't go with tension headache. And also treatment of migraine is different a bit from treatment of tension headache. So sometimes your doctor sometimes he will be honest with you, tell you, well, we're not really sure at this moment, at this stage, if it's a tension headache or a migraine. Let's try the treatment, then see if it gets better, then it goes more with migraine or it goes more with tension headache. So sometimes it needs more than one appointment to know exactly what you have. Okay, so let's go to treatment. Before treatment, we're gonna speak a bit about preventive measures. Of course, healthy lifestyle, sleep hygiene, sleeping in a good way. No different between normal days and between weekends. Try to sleep like 8 hours, and exercise is really good. If there's underlying stress and anxiety or even low mood, treat that, because if somebody's stressed or anxious or having low mood, they're not going to sleep well, and if they have tendency to get a migraine, they will end up having a migraine attack. So that's the first one. What your doctor will do, they will ask you they might give you actually, if your doctor had a migraine, a leaflet of a migraine diary, or sometimes they'll just ask you just to Google. If you write in Google migraine diary, you will find loads of sheets like this, and that's really good. As you can see here, there's 31 days. Okay, so that's a whole month, and this will give your doctor and even you an idea about the headache which you have, if it's a migraine or not, and what is the severity or sensitivity of your migraine. So as you can see here, let's go to the first one. So severity of the migraine scale from 0 to 5. So if it's like very severe or not. So every day you have to record that. That's like a homework. And then it also will give you an idea. Your migraine, does it come with aura or doesn't come with aura? So is it throbbing? Do you feel nauseous? Did you vomit? Are your eyes sensitive to light? Or is your headache, did it increase to sounds, to loud sounds? And how long did it last? Did it last just 1 hour, or did it last even like 3 days? And etc. As you can see here, like how is your sleep? Did it affect your work? Did you have to take days off work? So after 31 days, your doctor will look at all of this, and it will give them an idea about like your migraine, what's the severity of it. So what is the treatment of migraine following UK national guidelines? And that's why I opened this channel, just like to explain about the UK protocol just like to increase like knowledge, empower you with that. So if you have an acute attack, so for instance, if somebody is having a severe migraine acute attack, okay, the first line will be somatotropin. Okay, so you're going to try that orally, even with paracetamol and ibuprofen. You can take that. These are over the counter. Somatotropin, your doctor has to give it to you. Aspirin, very high dose, 900 milligram. Your doctor has to prescribe it. You can't just go and buy it over the counter. So again, that can be that's the first line treatment for acute migraine. Let's say if somebody is having a lot of migraine attacks, they're having like every week, and it's really affecting their work and social life, and it's really frustrating. So a preventive treatment actually is really good because it can decrease decrease the migraine attacks. So instead of having it like every week or maybe twice a week, maybe like having it maybe once every 2 months, or even some people, they don't have migraine anymore. So preventive treatment, usually there are 3 drugs which in UK they like to give, like propranolol, amitriptyline and topiramate. So what your doctor will do, they might give you this and then increase the dose. If this doesn't work, then they're going to try the other ones. If all of this doesn't work, then, and you're still having a lot of migraine attacks, the next step will be a referral to a headache clinic, or maybe to a neurologist, where you get seen in secondary care. So regarding today, sorry, I couldn't cover cluster headache. I couldn't cover headache because of sinusitis or other causes of headache. It's difficult to cover that. Or even there's another headache actually I didn't mention about, which is headache because of overusing medication, because somebody's taking every day Panadol and ibuprofen. That can also cause like a headache, and it's very common cause of headache. So I couldn't cover that, as I said, because of the time. But today we covered migraine and a bit of tension headache. So that's why it's important to share and subscribe and like the channel, so you get so every time, like 10 minutes, I just like speak about one of the subjects. Okay, so lastly but not least, it will be about like the red flags. Any person with headaches, if the headache is so severe, which wakes you up at night, especially if it's associated with vomiting or any visual problems, any weakness in arms, legs, numbness, that's a red flag. And the reason behind it, as I mentioned at the beginning of the video, we got worried that in case if it's something severe, like if there's a bleed in the brain, or blood pressure is not well controlled, blood pressure is very high, or if there's a brain tumor. So in this case, you need to call out of hour, urgent, or you need to even go straight to the A&E. Also, if there's like a severe headache with neck pain and high temperature, which doesn't go down with simple painkiller, and if there's like a rash which doesn't blanch, again, this is a red flag, because it could be infection in the brain, could be meningitis. Okay, so these are red flags which we really got worried about. And if you called one of your doctors, most likely they're going to tell you about these red flags, so you might even know it by now. So thank you very much. And if you have any questions, please just write them in the comments. Thank you. Bye.